the speed at which people are diagnosed and treated can be incredibly shocking in some ways. It's almost like your life was heading down a certain path and then everything changed, and within a month or perhaps a couple of months actually things have taken a very different turn. That can be, I think, take a very long time to process actually. Perhaps it's not something that can be fully kind of come to terms with at the time.
The key to a healthy life after a diagnosis of testis cancer is to look after yourself, and that challenge is something that actually we're not yet quite as good at as we'd like to be. We're actually very good at treating testis cancer. I'm not yet convinced we're so good at giving patients the information they need about leading a healthy lifestyle and the importance of a healthy lifestyle to maximise their chances of staying fit well for a long period of time.
Be reassured that it's very common for people to feel actually some quite difficult things after treatment finishes, and that this can be quite shocking. They can have an idea of, oh, I should be back to normal now, I should be feeling fine, when actually often they don't really feel fine. So to be reassured that that's actually perfectly natural, that that's not something strange or weird to do with you, that's what many people feel.
It's been coming up to a year now since I finished all my surgery, and it's got better with time. Actually, to be honest, I want to see my doctor more often to make sure that he's picking up things. You know, I'm quite happy to have CT scans, and I've got to the point that, you know, being checked as often as possible at the moment, whilst I'm still, you know, probably slightly fragile, I'd say, in terms of worrying about it, is a good thing. The CT scan and blood tests, and if it confirms there's a problem, I'd rather, you know, be told straight away than rather do what I did last time, which was, you know, sit on it for a couple of months.
I think often people want to know, well, you know, when am I going to feel okay? And actually it's very difficult to answer that question. For some people it might be that over a year or two actually things feel like they very much settle down, and having testicular cancer is an experience that has become kind of incorporated into their life, not just the entirety of their life for that moment in time. For other people, we know that actually some people for 10, 15 years afterwards can still feel some kind of ripple effects of having had testicular cancer. Actually, they can still feel maybe a bit low or a bit anxious or a bit irritable, or like something has changed.
There is a little bit of you get a psychological thing, oh God, what if? But at the same time, you can't live like that. You have to be positive. And I think what it has done to me, it's made me look at my life very differently now, and to live for the moment, live for the days, and, you know, live your life as full as you can, because you never really know what was around the corner. And before I got diagnosed, I was a bit of a workaholic, you know, doing 12-hour days, you know, and it's not really much of a life, really, when you've been given the chance to have your life back.
If anything, the only downside is that when I do sometimes get a little bit stressed or a little bit down, I have to almost kick myself to make me realise how lucky I am. And I'll put it in perspective, and that almost, you know, very quickly, kind of, then I can move forward again.
And I try and picture the fact that I've had to physically walk myself to the trolley for 3 times to go into theatre, and that's a very, very difficult thing to do, because it feels like the moment where you do a bungee jump or you throw yourself out of a plane, it's that when you don't have any control, you're actually letting your body, you're actually putting yourself in the hands of somebody else and doing something, in this case, that you don't want to do, that you have no control over, you can't hang on, and that you're free falling. And I think if I can do that, then hopefully I can do something else. I can push myself for the moments that I find hard, for the moments that I find that hard or difficult. I try and picture that moment, and that was a really, really hard thing to do. And if I can do that, then hopefully I can do anything.
Initially you have blood tests done every week, then after maybe a month it goes to every couple of weeks, then every month, then every quarter, then every 6 months. And certainly initially in the first 6-month period, I never used to think, am I going to get cancer again tomorrow? Is it going to come back? But I did used to be very apprehensive when I used to have my blood tests. So I had my blood test done and used to wait a couple of days, and I was literally on the phone chasing up my blood results. Even now, 16 years on, I still have my yearly blood test. But I don't even bother chasing. I don't even know what maybe the last 5 or 6 years worth of blood results are. My view is, well, if there's something wrong, they ring me, and they haven't rung me yet. So, but I don't think about it anymore. I really can't think the last time I thought, am I going to get cancer tomorrow? That doesn't enter my thoughts anymore.
There's a real need to understand more about what life is like for men after testicular cancer treatment finishes. So it's an area that's been researched less often than other kind of cancers, and often the kind of research that has been done has been using surveys. So it asks people to tick boxes on, you know, which of these 4 options kind of matches your experience more closely. I think there's a real need to start much earlier than that, from the kind of bottom actually, to sit and chat to young men about their experiences, about the parts of their experiences that are important to them, that are meaningful to them, in their own words actually.